Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. Have you ever felt that strange, prickly sensation in your legs or feet, like tiny pins and needles dancing under your skin? Maybe it comes and goes, or maybe it lingers, making every step feel off, disorienting, even worrying. This is more than just a minor annoyance. Numbness and tingling, medically called paresthesia, can signal underlying problems in your nervous system, circulation, or even your diet. Today, we're diving deep into what causes it, why your body reacts this way, and how simple natural foods can help restore normal feeling and function. You wake up one morning and notice a strange, prickling sensation in your feet. At first, you ignore it. After all, who hasn't felt a foot fall asleep? But then it comes back, stronger, spreading up your legs, sometimes accompanied by a dull ache or sharp electric shock. Every step feels different. Every touch feels muted. Your body is sending a message. Your nerves are screaming. And if you don't listen, the consequences could be devastating. Numbness and tingling, or what doctors call paresthesia, are more than mere inconveniences. They are warning signs. They are the quiet alarm bells that signal your nervous system is under attack and your body is struggling to communicate. Nerves are the lifelines of the body. They are the electrical wiring that carries messages from your brain to your muscles, telling them when to move, when to contract, when to react. They relay sensations from your skin, alerting your brain to temperature, pressure, or pain. When these pathways are disrupted, when messages are slowed, distorted, or blocked entirely, you experience that eerie numbness, that unrelenting tingling. Science tells us that these sensations are never random. They are symptoms of an underlying dysfunction, a nerve under stress, damaged by disease, compression, or malnutrition. One of the most common causes is diabetes, a condition that affects over 500 million people worldwide. High blood sugar silently damages the smallest blood vessels that nourish your nerves. Without adequate blood flow, nerves begin to die. Research shows that up to 50% of diabetics develop peripheral neuropathy, a condition where nerves in the extremities deteriorate, leading to numbness, burning sensations, and even loss of balance. Imagine walking through your day unable to feel the ground beneath your feet, your body betraying you with every step. This is not imagination for millions. It is reality. But diabetes is not the only culprit. Vitamin deficiencies, especially vitamin B12, are insidious. This vitamin is critical for the production of myelin, the protective sheath surrounding your nerves. Without it, nerves become damaged, signals falter, and your body starts sending those urgent, tingling messages. Studies show that up to 20% of adults over 60 have low B12 levels, often without knowing it, silently setting the stage for nerve degeneration that may take months or years to reverse. And the frightening truth is, numbness doesn't always stay in your feet. It can creep, slowly ascending your legs, disrupting sleep, mobility, and independence. Peripheral neuropathy, nerve compression from spinal conditions, chronic alcohol consumption, autoimmune disorders, and even certain medications are all silent assailants of your nervous system. Each prickling sensation, each moment of numbness is a red flag waving in your body's language. Ignoring it is not a harmless choice. It is a risk. Because if left untreated, what begins as mild tingling can progress to profound numbness, permanent nerve damage, chronic pain, and severe impairment of your mobility. This is why early recognition is crucial. Listening to your body is not optional, it is life-saving. The science is clear. When your nerves are deprived of essential nutrients, blood flow, or are chronically compressed, they stop functioning properly. Electromyography studies, which measure nerve activity, show delayed signaling in patients experiencing numbness. Imaging studies reveal nerve atrophy, blood vessel damage, and demyelination, often before patients even realize there's a serious problem. It is a silent crisis unfolding inside the body, unnoticed until it manifests in ways that dramatically impact quality of life. Even lifestyle factors play a significant role. Sedentary behavior, sitting for hours at a desk, crossing legs, or wearing tight shoes may seem trivial, but over time they reduce circulation to the extremities, compounding nerve stress. Smoking constricts blood vessels, reducing the oxygen and nutrients delivered to nerves. Alcohol introduces toxins that directly attack nerve fibers. Every small choice adds up, either protecting your nerves or accelerating their decline. The human body is miraculous, but it is not invincible. Nerves can regenerate, but the process is slow and delicate. Research shows that when the underlying cause of numbness is addressed, whether through glucose control in diabetes, B12 supplementation in deficiency, or improved circulation through movement, nerve function can improve dramatically. Symptoms can diminish, sensation can return, and the risk of permanent damage can be reduced. But timing is everything. Delaying action allows damage to progress, often irreversibly. There is a psychological toll too. Numbness and tingling are not just physical phenomena, they affect mental health. The unpredictability of sensation, the fear of stepping on uneven surfaces, the anxiety of losing mobility can create stress and insomnia. Patients often describe feeling disconnected from their own bodies. This is not exaggeration. Studies in neurology confirm that chronic sensory impairment alters brain function, impacting coordination, balance, and even cognitive health. Your body is sending signals, your brain is struggling to interpret them, and the longer you wait, the harder recovery becomes. But there is hope. The first step is awareness. Recognize that numbness is a symptom, not a trivial inconvenience. Identify patterns. Does it worsen at night? Is it constant or intermittent? Is it associated with diabetes, alcohol use, or diet? Medical evaluation, including nerve conduction studies and blood work, can reveal hidden deficiencies or underlying conditions before they cause permanent harm. And once the root cause is identified, your body can begin the healing process. This is why early intervention is not just recommended, it is critical. Daily habits, from walking to improve circulation, to dietary adjustments that supply essential vitamins, to medical management of chronic conditions, all converge to protect your nervous system. Each step you take, literally and figuratively, can be a step toward reclaiming feeling, sensation, and confidence in your own body. Every tingling foot, every numb toe is a message your body is desperate to communicate. It is warning you that your nerves are struggling, that blood flow may be insufficient, that critical nutrients may be lacking. Ignoring it is risky, but responding with action, awareness, and science-backed interventions is empowering. You have the power to intervene, to nourish, to move, to restore. Because your legs and feet are more than tools for movement. They are the foundation of your independence, your mobility, your life. The first prickling sensation may feel small, almost ignorable, but it is never just a fleeting annoyance. It is a signal, a call to action, a prompt to honor your body, to protect it, to give it what it needs before irreversible damage sets in. Your body is speaking. Every tingling nerve, every numb patch, every moment of altered sensation is a messenger. Listen, respond, act. Because the sooner you recognize the signs, the sooner you can reclaim the freedom of movement, the joy of sensation, and the security of knowing that your nervous system and your life are protected. The body doesn't lie. Numbness and tingling are the language of nerves under stress. The question is, will you understand it in time? Will you heed the warning, take action, and intervene with knowledge, science, and care? Or will you wait, hoping it goes away as the silent erosion continues? The choice is yours, but the evidence is clear. Early recognition, medical assessment, and proactive care are the keys to preserving your nervous system, and with it, your independence, your confidence, and your life. Imagine a network of delicate wires running throughout your body, transmitting messages from your brain to your muscles, from your skin to your brain. These are your nerves, the silent communicators of sensation, movement, and balance. And like any intricate system, They require fuel, specific nutrients, to survive, thrive, and repair. When your diet lacks what your nerves need, tiny messages become lost in transmission, resulting in numbness, tingling, burning, and weakness. But science shows that the right nutrition doesn't just support nerves, it actively repairs them, restores their function, and can even reverse early damage. This is the hidden power of food, and the stakes are higher than most realize. Let's start with the powerhouse of nerve repair: omega-3 fatty acids. These essential fats, abundant in fatty fish such as salmon, mackerel, sardines, and trout, are crucial building blocks for your nerves. The myelin sheath, the protective coating that surrounds nerve fibers, depends on these fats to remain strong and flexible. Without omega-3s, nerves become brittle, signals slow, and your body begins to miscommunicate with itself. Research published in the Journal of Neurochemistry confirms that omega-3s stimulate nerve regeneration, reduce inflammation, and improve synaptic signaling. This means the same nutrients found in fish can literally help your numb, tingling feet feel alive again. Incorporating fatty fish just 2 to 3 times a week isn't a luxury. It's a lifeline for your nervous system. Next, we turn to vitamins B12, B6, and folate, the trio of nerve healers. Vitamin B12 deficiency alone is one of the leading causes of peripheral neuropathy worldwide. Without it, nerves lose their protective coating, messages become garbled, and the tingling spreads. Studies from neurology clinics show that B12 supplementation can reverse early nerve damage, restoring both sensation and strength. But B12 doesn't work alone. B6 and folate help metabolize homocysteine, a compound that in excess damages blood vessels and nerves. Foods like leafy greens, spinach, kale, broccoli, and colorful bell peppers are loaded with these vitamins, along with antioxidants that reduce inflammation and oxidative stress, which silently erodes your nerve health over time. Everyday practices like adding a handful of spinach to your breakfast smoothie or roasting kale with garlic at dinner aren't just healthy, they are essential interventions for nerve survival. Magnesium and vitamin E play an equally critical role. Magnesium relaxes muscles, supports nerve impulse transmission, and regulates blood flow. Vitamin E acts as a shield, protecting nerves from oxidative damage that accelerates degeneration. Nuts like almonds, walnuts, and cashews, seeds like sunflower and pumpkin, and whole grains like oats and brown rice are perfect sources. Imagine sprinkling a handful of sunflower seeds over your salad or enjoying a small bowl of oatmeal with almonds in the morning. These small, daily choices deliver a steady stream of nutrients that calm inflammation, support myelin repair, and strengthen your nervous system from the inside out. Science is clear. Deficiencies in these micronutrients correlate directly with nerve deterioration, numbness, and chronic pain. The message is unmistakable. Feed your nerves or watch them falter. Antioxidants from colorful fruits like berries, oranges, and kiwis also play a hidden but powerful role. Free radicals, unstable molecules produced by stress, pollution, and metabolic processes, attack nerves and blood vessels, accelerating degeneration. Antioxidants neutralize these free radicals, preventing further nerve damage and supporting regeneration. Research from the Journal of Nutritional Biochemistry shows that diets rich in antioxidants reduce neuropathic symptoms and improve nerve conduction velocity. In other words, the foods you eat daily can literally influence how fast, accurately, and efficiently your nerves send messages, and how soon numbness or tingling disappears. The beauty of nutrition is not just in single miracle foods, it is in synergy, Pairing omega-3 rich fish with antioxidant-packed vegetables, sprinkling nuts and seeds on top, and supplementing with B vitamins creates a perfect storm of nerve-healing power. A meal like baked salmon with roasted broccoli, colorful peppers, and a sprinkling of pumpkin seeds isn't just dinner. It's a deliberate, science-backed therapy for your nervous system. Every bite strengthens, repairs, and protects. And when repeated consistently, daily, week after week, the results are profound. Tingling diminishes, numbness retreats, movement feels natural again. But nutrition is only part of the story. Hydration matters too. Your nerves are surrounded by water-rich tissue, and even mild dehydration can impair signal transmission. Drinking sufficient water daily ensures nutrients flow efficiently, toxins are flushed out, and nerve signaling remains precise. Combine this with movement, gentle walking, stretching, yoga, and you create a circulation-boosting, nutrient-delivering environment for your nerves to heal. It's important to remember that some nutrients are better absorbed when combined with others. For example, healthy fats increase the absorption of fat-soluble vitamins like vitamin E. Leafy greens paired with olive oil or nuts enhance nutrient bioavailability. Small, intentional dietary strategies magnify the healing power of food, turning every meal into a therapeutic opportunity. Science also shows that diet can prevent further damage. Patients who adopt nerve-supporting diets experience slower progression of neuropathy, fewer flare-ups of numbness, and reduced pain. One study in diabetes care highlighted that patients with diabetic neuropathy who increased omega-3 intake and B vitamin supplementation showed significant improvement in both nerve conduction and symptom relief in as little as 6 months. This isn't theory. It is observable, measurable healing happening inside your body. Every day, your nervous system faces assault, blood sugar fluctuations, inflammation, oxidative stress, and poor circulation. But every day, you also have the power to fight back. By intentionally consuming omega-3s, B vitamins, magnesium, vitamin E, and antioxidants, you are arming your nerves with the nutrients they need to repair, rebuild, and survive. You are literally feeding sensation back into your feet, your legs, and your life. The reality is stark. Ignoring nutrition accelerates nerve damage. Numbness spreads. Tingling becomes constant. Daily life becomes harder. But embracing nutrition transforms the story. Your nervous system begins to heal. Messages flow again. Sensation returns. Independence and mobility, once threatened, are restored. Food becomes more than sustenance. It becomes medicine. So start today. Include fatty fish several times a week. Fill your plate with leafy greens, colorful vegetables, nuts, seeds, and whole grains. Stay hydrated. Move your body. Pair your food strategically for maximum absorption. Each action compounds. Each meal builds strength. Each day nourishes your nerves and restores communication with your brain. Your body has a remarkable capacity to repair itself when given the tools it needs. Nutrition is the foundation of that repair. The foods you eat today, the choices you make at each meal, determine whether your nerves deteriorate or recover. Your legs, your feet, your ability to feel, move, and connect with the world are all within your control. Feed your nerves, support your system, and the numbness and tingling that once plagued you will fade, replaced by a renewed sense of vitality, mobility, and life. Because every bite matters. Every meal is an opportunity. And the moment you begin to nourish your nervous system intentionally, scientifically, and consistently, you start the journey from numbness back to feeling, from weakness back to strength, and from limitation back to freedom. You may have already noticed the subtle warnings, your feet going numb while sitting, tingling, creeping up your legs after hours at a desk, that strange prickling that makes you constantly shift in your chair. These sensations are not random. They are signals, urgent messages from your nervous system. And while nutrition is critical to repair and protect your nerves, the truth is, food alone cannot fully restore function without movement, circulation, and mindful lifestyle habits. Your lifestyle is the context in which your nerves live, grow, and heal. Ignoring it is like trying to repair a delicate circuit while leaving it plugged into a faulty power source. Every step, every stretch, every daily habit contributes to either degeneration or restoration. Let's start with circulation. Blood is the delivery system of life. It brings oxygen, glucose, and essential nutrients directly to your nerves. When circulation is impaired, nerves starve, messages slow, and sensations like numbness and tingling intensify. Sedentary behavior, sitting for hours at a desk, driving long distances, or even binge-watching TV, reduces blood flow to your extremities. Scientific studies show that prolonged sitting diminishes capillary density in muscles and nerves, limiting oxygen delivery by as much as 30%. This is not minor. It directly accelerates nerve dysfunction. The simple act of standing, walking, or stretching every 30 minutes can reverse this process. Research confirms that brief bouts of movement restore blood flow, improve nerve signaling, and dramatically reduce the severity of tingling sensations. But circulation is only one piece of the puzzle. Posture and positioning play a critical role. Crossing legs for hours, leaning on one side, or sitting with poor spinal alignment compresses nerves in your lower back and pelvis, creating chronic pressure that manifests as numbness in the legs and feet. Studies in neurology clinics consistently find that patients with chronic paresthesia often have underlying spinal or sciatic nerve compression caused not by disease, but by daily habits. Awareness is the first step. Simple adjustments, keeping feet flat on the floor, using ergonomic chairs, aligning your spine while sitting or standing, reduce nerve compression and prevent long-term damage. Movement itself is medicine. Walking, swimming, yoga, and even gentle stretching have profound effects on nerve health. Exercise increases circulation, reduces inflammation, improves insulin sensitivity, and stimulates the release of neurotrophic factors, proteins that promote nerve growth and repair. A landmark study in the Journal of Neurological Sciences demonstrated that patients with peripheral neuropathy who engaged in regular walking programs experienced significant improvements in nerve conduction velocity, reduced tingling, and improved balance within just 3 months. This is not abstract theory. It is measurable healing happening in your body, driven by the simple, deliberate act of moving. Balance and proprioception, your body's ability to sense position in space, are also critical. Numbness compromises your connection to the ground, increasing the risk of falls, fractures, and injuries. Targeted exercises, such as standing on one leg, gentle squats, or yoga poses, retrain your nervous system to interpret sensory signals accurately. Studies in physical therapy journals show that integrating balance training into daily routines improves gait, stability, and overall quality of life for patients with neuropathic symptoms. Movement isn't just exercise. It is recalibrating your nervous system, rebuilding the pathways that numbness once disrupted. Lifestyle integration also includes sleep and stress management. Chronic stress floods the body with cortisol, which constricts blood vessels, increases inflammation, and damages nerves over time. Sleep deprivation prevents repair processes in the nervous system, reduces circulation, and limits the absorption of critical nutrients. Research from neurology and sleep medicine journals demonstrates that patients with peripheral neuropathy who improve sleep quality and reduce stress report significantly reduced tingling and improved sensation. Meditation, deep breathing exercises, and consistent sleep schedules aren't just wellness trends. They are scientifically proven interventions that protect and restore nerve function. Footwear and ergonomics matter more than most realize. Tight, restrictive shoes compress nerves in the feet, particularly the tarsal tunnel, leading to tingling, burning, and numbness. High heels, narrow toe boxes, and unsupportive soles exacerbate these issues. Choosing shoes that fit well, support arches, and allow proper toe alignment is a simple yet powerful intervention. Combine this with padded insoles or orthotic devices when necessary, and you dramatically reduce the stress your nerves endure every single day. Hydration, though often overlooked, is another critical factor. Nerve function relies on water-rich tissue for electrical signaling. Even mild dehydration reduces nerve conduction efficiency, making tingling and numbness more pronounced. Drinking adequate water throughout the day ensures that nutrients delivered through food reach their target efficiently, toxins are flushed out, and nerve signaling remains precise. Pair hydration with dietary interventions, and you create a perfect environment for nerve recovery. The truth is that lifestyle integration is cumulative. Small daily decisions, standing instead of sitting, walking after meals, stretching before bed, sleeping well, managing stress, wearing proper footwear, staying hydrated, compound over weeks and months to create a profound impact on nerve health. It is not one single action, but the combination of all of them that restores sensation, reduces discomfort, and protects your independence. Science confirms this synergy. Studies on diabetic neuropathy, a leading cause of numbness and tingling, show that combining exercise, proper nutrition, sleep optimization, and stress reduction improves both nerve conduction and patient-reported outcomes far more than any single intervention alone. Your body thrives on consistency, on repeated, deliberate behaviors. The choices you make today shape how your nervous system functions tomorrow. Every step you take matters. Every meal, every stretch, every adjustment to posture or daily routine is a signal to your body that your nerves are valued, that sensation is worth preserving, that movement is not optional. You have the power to slow, halt, or even reverse nerve damage, not through magic, but through informed, intentional, evidence-based lifestyle choices. Your legs and feet are the foundation of your life. They carry you through your day, through experiences, through independence. When numbness or tingling strikes, it is not merely a discomfort, it is a warning, a call to action. Ignoring it risks long-term damage, but embracing lifestyle integration, moving, stretching, managing stress, sleeping well, hydrating, and choosing proper footwear empowers your nervous system to heal, recalibrate, and thrive. The remarkable truth is that your nervous system responds to consistent, deliberate care. Numbness diminishes, tingling retreats, balance returns, confidence in your movement is restored, independence is protected, life becomes fully felt again step by step, day by day. Lifestyle integration is not a temporary fix. It is a lifelong commitment to your body's most essential communicators, your nerves. When nutrition, movement, circulation, sleep, stress management, and ergonomics work together, your body begins a powerful process of repair. Symptoms that once seemed permanent can fade. Sensation that seemed lost can return. And the simple daily choices you make, often overlooked, become your most potent medicine. The body communicates constantly. Tingling and numbness are not inconveniences. They are signals, urgent messages and warnings. Nutrition can repair, movement can restore, sleep can heal, stress management can protect. Each element of lifestyle integration is a tool in the fight to reclaim sensation, strength, and independence. Ignoring any of these tools allows damage to continue silently. Embracing them activates your body's remarkable capacity for repair. Your nervous system is resilient, but it is not invincible. The sooner you integrate these lifestyle strategies, the sooner your nerves can recover, the sooner you regain the connection to your own body, the sooner you reclaim the freedom to move, feel, and live without fear of numbness or tingling. Life is meant to be fully felt. Every step matters, every moment counts, and every choice you make today shapes the nervous system you will experience tomorrow.